Hi, I'm Dr. Andy Barlow with the Chiropractic Neurology Center of Tupelo. I'm also the founder and one of 6 instructors with the American Functional Neurology Institute, and I can be found online at AFNIseminars.com. Today we're going to be talking about carpal tunnel syndrome. And when we're dealing with carpal tunnel syndrome, the first thing we need to look at is the neurokinetic chain. And what does that mean? We know that the symptom is in the hand in these 3 digits, but we have to look at this, at the brachial plexus. The brachial plexus is made up of C5, C6, C7, C8, and T1. And these are the nerves that come off the brachial plexus. Now the one that we're concerned about with carpal tunnel syndrome is we're focused on the median nerve, which comes off the lateral cord and the median cord. And this makes up the medial nerve. It's C6 to T1. Now this median nerve is going to come out of the neck through these, the brachial plexus. It's going to go through these muscles in the neck called the scalene muscles. It's going to come down your shoulder, down the arm, and the front part of your forearm. It's going to go into your hand. And what this is going to do is we have damage in any of this part of the pathway. We can have stenosis at the cervical spine. We can also have what's called double crush syndrome, which we can have a slight problem here, and we may have a problem with our shoulder, and the nerve gets crushed at the neck and the shoulder, for example. Either one of those by themselves wouldn't be a big deal, but you combine these 2 together, and we end up with numbness in our hands. We could also have what is called pronator teres syndrome. So people who have carpal tunnel syndrome a lot of times will have problems in spasm and pain in their forearm. So when a patient has carpal tunnel syndrome, numbness and tingling in these 3 digits, we need to look at the cervical spine, we need to look at the pronator teres, and we need to look at the digits in the hands. Now why this is important is because this median nerve, when we're looking at our hand, we're going to say this is our hand here. The median nerve actually controls the first 3 digits, like right here. It controls these first 3 digits, and then this actual lateral aspect, if I'm in the anatomical position, the lateral aspect of my ring finger. So we can actually do a digit span test. We can have a patient close their eyes, and we can actually touch their fingers and say, hey, how many fingers are between the fingers I'm touching? If a patient has carpal tunnel syndrome, they're going to have a very difficult time identifying what's going on with their fingers. We can also do a joint position sense test to see if they can actually tell whether the thumb is going up, down, in, or out. Also, what we would need to look at is we need to look at the metabolic aspect of care. A patient would need to bring in their blood work, and the very minimum we would want to look at is blood sugar, A1C, also the inflammatory processes that they may have, also along with anemia. All of this is going to affect this nerve transmission from the cervical spine into the hands. So again, we need to look at the neurokinetic chain if a person comes in with carpal tunnel syndrome, numbness in the hands. We need to look at the neck, the tension in the neck, the muscle tone in the neck, also the pronator teres, and we have, one thing I forgot to say, is we have a trigenics technique that works very, very well, and it's very, very powerful for patients suffering with carpal tunnel syndrome. And in most, not all, but in most situations, a patient does get symptom relief with just in a couple of visits. They start to notice some improvements with this therapy. So we need to do decompression or traction on the neck to decompress this stenotic neck. We need to do laser in the neck or down this entire median nerve pathway. We'll need to do trigenics on the hand to get the pressure off the area in the carpal tunnel. So the next thing we're going to do is I'm going to show you a couple of procedures that we use using the M6 laser. Okay, this is the M6 laser. This is a 25-watt class 4 laser that's unassisted therapy. Yes, class 4 laser that's unassisted. And I love this piece of equipment. Our patients love this equipment. Now we're going to assume that Forrest, he comes in and he's got numbness and tingling in the hand. We've done a neurological exam. We've taken x-rays. We see that we do have stenosis in the cervical spine, even though the patient has numbness in their hands. And so we're going to take this laser, we're going to turn it slightly to the right side of the neck, and we would turn it on. So you can see exactly what the laser is going to look like. This has 25 pre-programmed selections in here. And we can actually vary how long this beam is or how short it is. We can go right and left, we can go up and down. Now, I'm just going to show you one procedure that we're going to do here today, but also not only would we look at his neck, we may have to look at the spleen muscles here because he may have spasms in here, and we may have to shoot the laser along the pronator teres. Because again, we may have pronator teres syndrome that's affecting this carpal tunnel. There's a specific neurological exam you have to do to tell if it's pronator teres versus carpal tunnel, but that's not the purpose of this video here today. And then we may have to shoot the carpal tunnel as well. And then we would do trigenic therapy on his hand. So when we're looking at a patient who has carpal tunnel syndrome, we need to look at the entire neurokinetic chain, starting with the neck, and we may have to shoot the laser down the entire length of the nerve. Now what we're going to do next is I'm going to show you what we need to do to distract the neck and actually some specific therapies. We will put some gloves on his hands. It's called peripheral neuropathy rehab therapy through the Rebuilder Medical Group, and you can go online at rebuildermedical.com and look at this therapy. So we're going to go into the head, neck, and shoulder machine, and that will be the next procedure that we use. All right, this is our head, neck, and shoulder machine that we have here, which of course is on, and we can see that we have a head harness, and what we're going to do is we can distract to the patient's comfort. We can distract the cervical part of the neck here. This is going to pull the neck and distract it up. As you can see, Forrest also has some gloves on his hand. This is called the Rebuilder therapy or peripheral neuropathy rehab therapy. Peripheral neuropathy rehab therapy, it stimulates the nerves at 7.83 hertz and helps rebuild the nerves in your hand. So what we've done today is we've talked about if a patient comes in or a person comes in and suffering from carpal tunnel syndrome. Well, we need to look at their hand, but also we need to look at the neurokinetic chain from the cervical spine throughout the entire track and neurological pathway of the median nerve. We also need to look at laser therapy. Laser therapy is phenomenal for patients suffering with carpal tunnel syndrome. Laser therapy has been shown to decrease inflammation, decrease pain, and help the tissues respond and heal faster. I'm Dr. Andy Barlow. I'm a board-certified chiropractic neurologist, and if you have any questions, whether you're a doctor or a patient, if you would, you can call me at my clinic at 662-844-1414. I've enjoyed spending this time with you today, and I hope you've learned some information about carpal tunnel syndrome.